Okay, where was I? So we're going to talk about painful periods, right? We're going to talk about painful periods, and I was saying that there there is something that women who have painful periods always say over the years, right? Yes, Kafi always knock. Make no mistakes about it. Lewame is from South Africa. Do you understand what we mean by knack? Lewame, confirm to me if you don't know, because I want everybody to understand, right? So where was I? So we were talking about what many women who have painful periods, what they've always heard over and over and over again, right? So often they feel like period pain is normal. They'll just enjoy it. It's normal, right? So the cycle repeats. You're always waiting for the next month of pain, just because you are a woman. You have been sentenced to menstrual pain. Is this normal? Is this normal? Every month you have an how do they call it? An August visitor, right? The cycle continues. You prepare for the pain every month. You adjust your schedule. I'm not going to put serious business. It's just so time so that when the pain starts, I will not go to work. You adjust your schedule because of menstrual pain. You take painkillers just to function. Is this normal? Would God create a human being to suffer pain every month? Have you thought about it? And for a lot of them, over time, it becomes something they have accepted. Every heartbeat tells a story. That's got to the point of acceptance. But tonight, I bring you clarity. I bring you education. Right? Let's clear this thing. Desire Monday, you're welcome. If you're just joining, you're welcome. If you're not following me, you want to follow me now, because you will never hear this kind of things anywhere else, right? So you're welcome. So let's clear the air on menstrual pain or period pain, right? Severe or disabling period pain is not normal. It's not normal, but it is a signal. What did I say? Severe or disabling period pain is not normal, but it is a signal. Who is interested in hearing about this signal? Oh boy, we have more than 10 people in the house. If you are ready to hear about this signal, talk to me in the comment section. Just type ready, and I know you are there. Oh boy. You are in for good information tonight. If menstrual pain has been your matter, today we will solve that problem. Is that okay? And those of you that are good at taking painkillers every month, I'm here for you tonight. Is that okay? So, but remember what I said. Severe pain or disabling period pain is not normal, but it is a signal. It is a signal. So let's go straight into the issue, because if you ignore the signal, it means that you want to delay your answers, especially for those that are trying to conceive. We will not accept disabling severe menstrual pain. We will not accept it. Some people have accepted it, but tonight we no go gree. We no go gree. We no go. We will not accept it. Because painful period is not supposed to be normal. Do not accept it that it's normal. Right? Let's let's take a look at this gist. All right. The first thing we will need to consider is to first identify what is actually a normal period discomfort. Right? You say, okay, this is my period. This is the discomfort that is supposed to be normal. Let's start from there before we now deep dive into this period pain issue. Good evening, Eze Chineye is here. Luigi is here. So, quick one, just to be fair, right? Some level of discomfort during menstruation can happen, right? I miss you too. Thank you for checking up on me. I miss you too much, right? Thank you. This is fertility. Right? So, I said that some level of discomfort during menstruation can happen. That is normal, right? For example, you can have mild cramping. Yeah? Mild cramping. And that mild cramping is actually not a long experience. It's a short-lasting experience. That is normal. And it is manageable without using heavy medication. You don't really need medication in that sense, right? That will be a normal cramping, right? And it does not stop your daily activity. That is what normal period would look like, right? Why? Because the mild discomfort that you feel is actually linked to normal uterine contractions. If you have been here for some time, I've actually explained what happens to you. The uterus is not just there like that. No. The uterus has activities. It's actually in a continuous state of light contractions like this. So your uterus is alive, right? It's alive. Right? So it's in that continuous state. And when it's time for menstruation, that contraction may increase a little, which will cause you some level of discomfort. But this discomfort is short-lived. It does not last. It is manageable. You don't have to take drugs or any heavy medication to stop it. And it does not stop your daily activity. That is what a normal cramp or menstrual discomfort should be like, right? But unfortunately, that's not what many people experience. Now, I know a lady who, the moment is her period like this, she has shut down for 1 week. Is that supposed to be normal? No, it's not normal. Right? And that my dearest girlfriend, for those who have been here, you know her. That my dearest girlfriend, that we always quarrel every month. Right? That one, the moment period starts, that's a don't boss. Right? So, let us now look at when this pain, what is supposed to be mild cramp that is supposed to be within a normal discomfort, when the pain crosses the line. When it crosses the line. When it becomes an abnormal menstrual pain. Right? You should be concerned when it stops you from walking or moving normally. Have you not seen people during their menstruation, they are shut down? You've not seen them. Why? Anyway, that's not normal, but that it is what it is, right? So if it's stopping you from moving normally, if it's stopping you from walking normally, it has crossed the line. You should be concerned when it requires a strong medication to control.
This is fertility.
I hope you know that painkiller does something to your liver. I hope you know. For those who were here when I talked about paracetamol poisoning, I've talked extensively on that. Right? So you should be concerned when this your menstrual discomfort, which is now menstrual pain, if it requires strong medication to control it. It is concerning. When it begins, when the discomfort begins before the period and it persists, it will be concerning. Like those that you will not see them at work for the next 1 week. In fact, their own work is 3 weeks every month, right? Then there are those that have painful periods that get worse over time.
This is fertility.
And when this bleeding, for some people, some it is associated with heavy bleeding or clots, right? So all these things I just mentioned, at this point, when you begin to see this, the body is not just reacting. The body is not just reacting to something. It is actually communicating that something deeper may be wrong. And such is the case of many people today. And they've now normalized it, that this is me, this is my period. No, it's not normal. Right? Your body is communicating that something deeper is wrong. Right? So that leads us to what causes pain in the first place. What causes pain in the first place? Who is ready to hear something tonight? Talk to me in the comment section. Just type ready in the comment section. Let me be sure you are ready for this painful menstruation, painful period. I want to talk about what causes painful menstruation in the first place. So that the next time you start rolling on the floor, you know what to do and where to go. Right? Who is ready? If you are just joining, you're welcome. Make sure you are following me. Tap on your screen and share the live. If you know any woman that is trying to conceive, invite her to join the live stream. And if you are suffering from painful menstruation, tonight is your night. Don't go to bed without learning anything. Right? Painful menstruation is the gist. Fertility is the live stream. You're welcome. If you are trying to conceive, go to my bio, tap on the link and download this book, The Preconception Blueprint. It will help you prepare for pregnancy, whether natural or IVF. Nobody told you that you're supposed to prepare. You are supposed to prepare. Regardless of the treatment you are going to get, you are supposed to prepare. It gives you a better chance. Increase your success rate. Go and study the book. Learn it and do it. Right? And by the way, the book is for those who are ready to knock. As you are studying a book, you are supposed to knock. All right, let's continue our gist. Let's continue our gist. So what causes menstrual pain, period pain in the first place?
This is fertility.
Right? The very, very important information.
This is life.
Right. Now, During menstruation, right, the uterus would, during menstruation, the uterus would contract. Remember that the uterus is always doing this, right? So during menstruation, it becomes a little harder. So it contracts to shed the lining. Otherwise, how else will the menstrual blood come out if the uterus does not squeeze it out? Aha, you begin to see something. The menstrual blood does not just pour out. Something must make it come out, right? Something must make it. Thank you for the heart, me, Lady G. Right? So during menstruation, the uterus contracts to shed the inner lining. So as it continues to do like this, do like this, do like this, the uterine lining begins to fall. Have you not wondered? This blood will come out and the whole uterus will become clean and neat again until the next month. How did this housekeeping happen? How did they sweep all the blood out? It's because of that constant contraction. Is that okay? And these contractions are powered, or they are driven by one chemical we call prostaglandins. Don't worry about the name, but just know that something is powering it. Is that okay? Now, higher levels of that chemical prostaglandins, as the chemical goes up, the contraction becomes stronger, right? And as the contraction becomes stronger, it cut off or reduce the blood flow that comes to the uterus. And when that happens, pain will increase. So increase in that chemical called prostaglandins will lead to stronger contractions. And stronger contraction will mean that even the blood supply that is making the uterus do well, right, will be cut short. Thank you for the heart, man. Right? And that increases pain. But this is the key. Excessive pain often means excessive prostaglandins activity. Underline this. If you do not understand anything, just at least hold this sentence in your mind. Excessive pain often means excessive prostaglandins activity. Or it means that there is an underlying condition that is amplifying the pain. Understood? Even if you don't understand, take note of that information. Now, there is a hidden cause or causes behind severe pain. The hidden causes. Let's open that up properly and see how we can identify those hidden cause behind the severe pain. Yeah, okay, if you are still here, please tap on your screen and share the live. Tap on the screen. Now, let's look at some of these hidden causes of severe pain. All right? I will look at it based on some conditions, whether the conditions are subtle or they are serious. But you just need to know that is there, right? So we'll start with the first one. The first one we want to start with is have you heard of endometriosis before? Some of you have heard it before. Endometriosis. And this is one of the most common and most missed cause of severe menstrual pain. We already know what normal discomfort in menstrual period is. So we are looking at all the severe cases. Right? endometriosis, and that's one of the most common, but yet it is missed. What is endometriosis in the first place? This occurs when tissues that are similar to your uterine lining, when they grow outside the uterus. That's what endometriosis is. Right? Imagine your uterine lining that sheds every month. Tissues like that are now growing outside somewhere, outside the uterus. Right? Go to my video in my profile. I've done a video on endometriosis. You will understand it better. It is one of the major, or rather most common cause of severe menstrual pain. Right? So when these kind of tissues find themselves growing outside the uterus, what happens? What you begin to see is intense pain. Intense pain. Even inflammation, right? And this pain during periods, and it will occur during period, and even after the period, the pain is just there. Why? Every heartbeat tells a story. Let me tell you something. This condition can affect fertility if you don't address it. It is one of those things that your doctor will be looking out for if you are trying to conceive. Right? So that is condition number 1 that can cause severe menstrual pain. Is that okay? Condition number 2. Condition number 2. If you've not heard the name before, don't worry about it. Just know that there are things, but I need to mention them so that when you hear them tomorrow, I already know. Adenomyosis, something called adenomyosis. If you don't bother about the name, just know that there's something like that. Adenomyosis, right? Now, it's when just consider the wall of your uterus behaving like a sponge, right? The uterine lining, right, grows inside the muscles of the uterus. Everything that makes your inner uterus is now finding itself inside the wall. That is what adenomyosis is. I already have a video on that in my profile. Go and check it out. Then you understand it. Just search adenomyosis, you see it. Is that okay? So this condition leads to heavy and painful bleeding. Yeah? So that's why you need to have professionals that can check you and evaluate you correctly. So adenomyosis can lead to heavy and painful bleeding, enlarged uterus, right? In this year alone, I cannot even count how many of such cases like that I've seen. Adenomyosis. Some people do have it, but you just feel like I have pain normally, or the pain started last year and it has been like that. Don't normalize pain. Go and find out what is causing the pain. Right? So you have heavy and painful bleeding, your uterus is enlarged, right? And the cramps are deep and persistent. Deep and persistent cramps. Disabling pain that shuts down your day. Alright, so that is adenomyosis. How many conditions have we mentioned that is responsible for these painful periods? 2 so far, right? Let's deal with the third one. If you're just joining, you're welcome. Please tap on your screen, share the live. The third one is the almighty fibroids. Almighty fibroids. Yeah, fibroids. Okay, first of all, understand that fibroids are non-cancerous growths in the uterus. They are not cancerous, right? And now, but they can cause uterine contractions, right? They can cause pressure in your lower abdomen, right? They can actually cause pain and heavy bleeding. I think such is the case. One of those cases I saw today of a middle-aged woman who complained 2 months of heavy bleeding and pain during menses. And when we did the evaluation, we saw that, oh, she has fibroid in some funny places. You understand? So fibroid is one of those notorious conditions. Is that okay? That can cause painful bleeding. Is that okay? Please talk to me in the comment section. Are you still here? Just type, I'm here. If you're just joining, you're welcome. Tap on your screen, share the live. Are we still here? I'm not seeing any activity in the comment section. Maybe everybody have gone to sleep. Have gone to bed. Right. The other condition that can cause heavy bleeding, serious pain rather, is pelvic inflammatory disease or pelvic infection, right? So this is a condition affecting the reproductive organ, right? And when there is infection in the pelvis, it can increase the sensitivity, right? And also trigger pain during menstruation. Of course, what do? Go and treat it. Is that okay? Then hormonal imbalance also can cause it. Severe pain when estrogen and progesterone, when they are not in balance. If you don't know anything about estrogen or progesterone, please go to my YouTube channel, search estrogen, search progesterone. The videos will come up differently. Watch it over and over again so that you can understand why they are behaving like this, right? So hormonal imbalance, where the estrogen and progesterone are not balanced. So what happens in this case is that, remember, prostaglandins level may go up. Then the uterine contraction becomes stronger. So the harder the contraction, the more the pain. That's the simple idea. So it's not rocket science. It's just to know which one is your case, and from there you begin to walk through, right? Pain is not just discomfort. It can be a clue. When you feel pain, don't say, that's why they feel this thing. That pain can be a clue, right? Because many conditions are behind painful periods. Every heartbeat tells a story. Right? Many conditions are behind it. And they can affect ovulation, disrupt the uterine environment, and interfere with implantation. You don't want this to happen to you if you're trying to conceive. No, you don't. So when you ignore the pain, you know what you are doing? Opportunities for early diagnosis will be missed. Right? So do not ignore it. Normal mild cramp during menstrual period is normal. But when the pain has become, be careful. Your network is wounding you. Okay, it's not allowing you to download. Okay, you can try it anytime. You can try it even outside the live stream. I think it's network. I think it's network. You just keep trying it, it will go. Is that okay? If you're trying to conceive, go and download this book. The Preconception Blueprint. Download it. When the network gets better, you download it easily. It's always a matter. Go and download it if you're trying to conceive. Don't even start without knowing what is there. If you want to increase your chances and success, right? So it is bad to normalize. In fact, it is dangerous to normalize menstrual pain. Don't do that. It's one of the biggest problems, right? It's one of the biggest problems because we have made a culture out of it, right? So don't normalize pain, because when you normalize it, you delay the time it will take for you to seek help. Some people, it's only when they are now trying to conceive that they discover that there is a problem. But they've been having this pain all their life. They didn't bother. Normally, it's when you are looking for a baby, that's when problems start. Because if you suspend checking it out early, right? By the time you are now looking for it, or rather, by the time you now go for evaluation, the condition may have progressed. So it's now difficult for a doctor to manage than when you... So these are the issues, right? So don't normalize it. You feel a pain, even when you are not trying to conceive, go and check it out. So that the earlier, the better for you. Is that okay? Now, for those who are in the habit of using painkillers, oh boy, painkillers gang. Listen, painkillers are just a relief, not a solution. Right? But let's be clear. Let's be clear, because if you are not told, you will not know. And more likely, nobody is ready to tell you anything. Is that okay? Now, pain medications can reduce symptoms. What did I say? Can reduce symptoms. Symptoms are not cause. Symptoms are the notification that something is wrong. Just like, for example, now, I sent you a message. You get a notification. That you got a notification. Have you received the message? No, you have not received the message. You've got to go to the message and open it up and get the message I'm trying to send you. But you say, oh, I received the message because I got the notification. You have not received the message. So what I'm saying is that pain is just a notification. And painkillers treat the notification. They are just symptoms. And they are not treating the cause. Right? So painkillers or pain medications can reduce the symptoms. It can improve your comfort for a time, right? But they do not identify the cause. They do not. They do not treat the underlying condition. Painkillers will not treat menstrual pain. You're just deceiving your brain to think that the thing is no longer there, but that thing is there, right? Yes. Why they have a role, right? Please do not use it as a replacement for evaluation. And that is the situation many young single people will continue to suffer menstrual pain, and they think it's normal. The only time they discover they have a problem is when they are now trying to conceive. By that time, the situation has progressed. Managing it now has become a problem. MSEG is here. Right, so what did I say? Painkillers, relief, they are not a solution. Right? Now, this is what you should do. If the period pain is significant, the next thing you should do is not to endure. Do not now exercise patience and endurance. No. Go and investigate. All right? Go and investigate it. And investigating it means you go to a doctor, they'll take your history, they'll do a pelvic scan to see what's going on there, right? They'll do hormonal assessment, right? Thank you very much, I'm saying. They'll do a hormonal assessment. Even they may even ask you to do further imaging if it's needed, right? Because when you identify the cause, you change everything. Many people are not interested in identifying the cause. They just want to carry their womb, give you, say, doctor, take my womb, solve all the problem, make pikin come, give it back to me. That's what some people want to do. No, that's not how it works. You ought to be part of the gist, right? So this is a more accurate way to look at it. TikTok, what's happening now? Right? This is a more accurate way to look at it. Instead of asking yourself, how do I cope with the pain? Please don't be coping with the pain. You have a menstrual pain and you don't pass, be careful. Right? It's past what I call normal. If you were here from the beginning, you know what the normal menstrual discomfort should be. Right? If it has passed that level, go to whether you are a teenager that is just seeing your menstruation, or you are in your 20s, or you are in your 30s, you just got whatever categories you find yourself, go for evaluation. Don't normalize it. Don't cope with the pain. Right? So, one of the questions I'm helping you to ask tonight is, why is this pain happening? And by now, you already have an idea. You already do. But this is what will lead you to the next phase of your journey. Because you need to approach it in a better. Some people is just, what did I say? Some people it may be endometriosis, some others adenomyosis, some others fibroid or fibroids, some others hormonal imbalance, some others pelvic infection. Identify your own and take care of it. Move on with your life. Or some people are suffering for a very long time. Right? So if your periods are painful enough to disrupt your life, don't normalize it. It is not normal. So how does it disrupt your life? You're not going to work. The whole of that day shut down. You cannot walk well. That is disrupting your life. Don't normalize it. Thank you very much, Lady G. I appreciate you. Don't normalize it. Don't compare your pain with others. Don't say, that's what my friend was feeling menstrual pain. They give him a bowl, they drink it, everywhere they good. No, don't do that. Don't do that. Remember, I just gave you 5 things that can cause severe pain, cause severe menstrual pain. So your friend's case may just be infection. What if your case is adenomyosis? Will the same agbo take care of your case? No. Right? So mothers that have young girls in the house that they started seeing their period and they all know they're good, please get them evaluated. Yes, menstrual discomfort is there, we know. But when it has gone beyond what is normal, get them evaluated early so that they will not now go and be looking for a solution when they are trying to conceive. And by that time, they cannot be helped. or they have minimal
This
help,
is fertility.
right? So don't compare your pain with other people. Don't wait for it to become unbearable. I see people cry as though they are being tortured in the name of menstrual pain. That is not a normal menstrual pain. That is not the normal menstrual pain. You need to listen to what your body is telling you. Your body is sending you a signal through that pain. You say, no, we're going to manage it. Give me Panadol. Give me Panadol. Or what's that medicine they take these days?
This is fertility.
That women they started putting it in their bag like part of their makeup, right? Felvin, thank you. Listen to your body. Why? Because these things you are taking, I hope you know your liver is suffering. Hope you know. Thank you, Lady G. I appreciate you. Right? I hope you know your liver is suffering.
Every journey begins with hope.
And how long are you going to continue?
Every heartbeat tells a story.
That you are feeling painful menstruation does not mean that you are weak. It's not weakness. It's just an information. Your body is trying to tell you something. A lot of people from their puberty time up until now they are trying to conceive, they've always had very painful menstruation. They never checked. Now they are trying to conceive. They discover that, oh, you have adenomyosis. Oh, there is endometriosis. Don't wait until it gets bad. So for those of us who are already advanced, you have younger people, you want to help them on time, right? Take them to a gynecologist, right? Is that okay? So that everywhere will good early. Because I tell you one truth. Anyway, I will always tell you truth every live stream, right? So I always tell you truth. See, think about it. If you were God, something that is supposed to benefit you, would you put pain? Forget that thing that is, it was Eve. Eve will go do longer throat for apple. That's why God cursed. It's not true. It's not just religious jargons. It's not true. It's not true. So I said that to say, your cycle is meant to function. Your cycle is meant to function. It's not meant to punish you. It's not true that it was because of, no. Because if it's true, then every woman in this world should feel the same pain. Like they are feeling labor pain, right? So menstrual pain should not even exist in the first place. But we are downplaying it, normalizing the pain. Your cycle is supposed to function, not to punish you. You did not do anything wrong to be a woman. Is that okay? And when the pain becomes a regular part of your cycle, it's not something you accept. It's something you need to understand. Normally, you may not really hear this, but I'm bringing it tonight so that you go back and check where have you missed it, right? And help your younger ones also. Let them not miss it, because behind that pain, there's often a reason. Pain does not just happen. If, for example, I tell you, oh, I'm feeling headache, it doesn't just happen. There is a reason for the headache. That's what you should be looking for. Oh, I'm feeling back pain. There's a reason. That's what you should be looking for. I'm having menstrual pain. There is a reason. That's what you should be looking for. And I have tried to open that system to you tonight, right? But once you find the reason, what happens? You move from enduring pain to resolving the pain. And that makes life easy. That makes life easy. Who doesn't want to live a life without menstrual pain? Go and ask those people that have menstrual pain. Let them tell you how far. Right? So that is the issue. So
This is fertility.
that's what I have to tell you tonight about menstrual pain. If you have a question, come and ask me.
This is life.
Otherwise, I need to go. We've talked about stress. We've talked about weight. We've talked about PCOS, prolactin. If you've missed any of these things, go to the YouTube channel and learn them. Study them. It will save you cost, energy, and pain and worry. Right? So tomorrow, I will look at when you are seeing your menses and clots is coming with it. That's what we'll look at tomorrow. And as usual, we'll tell the whole story in details.